Hello, everybody. Good evening. This is Dr. Nicola Ducharme here, and welcome to our webinar tonight, 3 updates in Lyme disease treatment. So before we jump in, I'm just going to do a little tech check. That's always my big thing. And just make sure you can see me and hear me. So can I ask somebody just to put in the chat and just let me know that you can see me and hear me? And that way I won't feel like I'm talking to myself for the next hour or so. All right. Thank you. Thank you. Excellent. Excellent, excellent, excellent. Brilliant. Okay. So I am going to share my screen in a minute and just share some information about what we're going to cover tonight and just give you a little background, and then we will jump right into content. But thank you so much for joining me. Welcome. And I hope that you learn new things tonight and get some different perspective in this webinar. So I am going to go ahead and share my screen and we will get going. There we go. So let me just introduce myself briefly for those of you who may not know me. I am Dr. Nicola Ducharme, as I mentioned. I'm a Lyme literate naturopathic doctor, and I'm the owner and medical director of Restore Medicine, which is in sunny San Diego in California. And I've been working with Lyme for about 15 years, graduated from Bastyr University in 2003, and spent my first couple of years really working more with autism and kids on the spectrum. And it was just a general natural progression to working with Lyme. I started seeing some of the mums of the kids that we were treating in our clinic. And these were like 30-something-year-old women, and they were, I'm tired, everything hurts, I've got headaches, what's wrong with me? I thought it was just like the post-kid syndrome, but it just didn't seem right. And as I did more of a functional medicine evaluation, more and more of them tested positive for Lyme. And so that's kind of how it all began for me. And now treating Lyme is about 99.8% of my practice. So that's pretty much what I do. I am the author of The Lyme Diet, which has been around for about 10 years now, and I'm really proud of that. I think it's helped a lot of people like with their nutrition and figure out what to eat through this whole journey. The Beginner's Guide to Lyme Disease in Australia, and the latest one is called Lyme Brain. And I'm just really committed to helping people find solutions. As I'm sure all of you listening well know, chronic Lyme is brutal, and there's so much misinformation. It's so politicized. It's really, really challenging on so many different levels. And so it's sort of just become my life's work and my calling to do what I can do to help. And so that's kind of the place that I'm coming from. So just to go over what to expect tonight. So I work with Lyme using an integrative approach. So when I was coming up with, 3 updates, and these aren't all brand new things, but these are 3 things that have really caught my attention. And in a brief second, I'll tell you what those 3 things are. But they've caught my attention, and I've been utilizing at least 2 of them. One is newer to me, and we're all still learning. But I just wanted to be able to share the information that I have accumulated so far. We all know with Lyme, there's just no magic bullet. I wish there was, and I would be screaming it from the roof and retiring and moving to Australia. But it's complex, it's multidimensional. So I wanted to give kind of a really integrative, well-rounded view. And so you'll see with these 3 modalities, they're all completely different, polar opposites from one another. But I think sometimes we need to look at how different things can factor into the healing experience. I'll spend roughly 10 to 15 minutes on each one. I'm going to try and keep this close to an hour. I don't make any great promises because I do have quite a lot of information. I don't want to skimp on what I want to tell you. So if we run over the hour, I apologize, but so be it. And I will look at questions at the end. So once I share my screen, I can no longer see the chat box. I can no longer see the question and answer box. But if you have questions along the way, do put them in the Q&A section, and I'll see how we go, like depending on how we go for time, et cetera, but I won't be fielding questions along the way. And I will have a replay link. I know some of you will be listening to this later on the replay, I really had a great response to this webinar, but not everybody can make the time work. So it is being recorded. And I will also email, I've got some links here, resources. Throughout the presentation, I will email them tomorrow as well, by end of day tomorrow, just so you've got everything in the one place. So that's our kind of housekeeping. So what are we going to talk about? The big mystery. What are the 3 updates? So the 3 things I want to cover this evening are the dynamic neural retraining system, NERV2 activation or cellular activation, and a medication called Disulfiram, also known as antabuse, that is sort of really new in the context of Lyme. And so we're all still feeling that out and all still kind of trying to figure out the role it plays and where it fits. And so I'm going to just share information of what I have kind of accumulated so far on that medication. So let's just jump right in. Dynamic neural retraining system, also known as DNRS. I have seen, it's been on my radar for a long time, but I've had some patients more recently in the last few months kind of committing to the program, and I'm really seeing some wonderful things with it. So let's talk through DNRS. So the bottom line is the program is based on the premise of limbic system dysfunction, right? And we're going to talk about what that means and what that looks like. It is also neuroplasticity-based rehabilitation. Okay, so that might just sort of sound like a bunch of long words, and what does it mean? Neuroplasticity is fascinating to me. It's a whole new field of neurology and of science that tells us that we can influence our brain wave patterns and our neurons. We can influence those. We can, grow and strengthen neural pathways. And so the brain is not a static thing as we used to think it was. And if neurons die, that was all just too bad. And, you're out of luck. And eventually, if enough die, you lose a significant amount of function. But now we know that we can actually influence those neurons. We can influence neural pathways. So that's kind of the bottom line of it. So looking at what is the limbic system? The limbic system is a part of the midbrain, so it's part of our nervous system, and it incorporates the hypothalamus, the hippocampus, the amygdala, and the cingulate cortex, right? So there's your neuroscience lesson for the day. You don't need to know all the ins and outs of what all those individual structures do, but suffice it to say, the limbic system is very involved with many aspects of cognitive and psycho-emotional health. Right? So it's described sometimes as the feeling and reacting brain. It has a lot to do with social and emotional intelligence, with the formation of memories, with one's feeling of safety in the world, and also of anxiety responses. So there's a lot there, and with the memories and the brain function as well. So there is a lot of cognitive involvement. There's a lot of psycho-emotional involvement with the limbic system. But beyond that, it also influences many physical responses, okay, and physical functions. And so this is where it plays into when we're talking about chronic Lyme or mycotoxin illness or some of these sort of things that seem like more physical per se, but this is how it relates. So the limbic system does influence immune function. It influences hormone regulation. If any of you heard that the pathway for hormones is from the hypothalamus, which is part of the limbic system, sends signals to the pituitary gland. The pituitary sends signals to the adrenals, the thyroid, the ovaries, the testicles, and dictates what hormones are produced there. So that all starts in the brain. It's not just about the endpoint hormones, it starts in the brain. It also influences the autonomic nervous system. So things like breathing, blood pressure, the heart, your digestion, things that you don't think about and they just happen naturally, or hopefully they do. Like we don't think about breathing. We don't think about our heart beating. And so that's all like considered the autonomic nervous system. Pain responses and inflammation has a lot to do with that. It's involved with sleep regulation, cognitive function we've already mentioned, and also plays into sensitivity to smell, light, sound, chemicals, EMFs, the whole kit and caboodle. So how does the limbic system get stuffed up in the first place? It can be psychological and emotional trauma. Okay, so traumas in one's life and emotional upheavals certainly can influence and impair the limbic system. And in this, I include Lyme-related PTSD. Okay, and I love the way Robert Bradfield is one of the top Lyme literate psychiatrists. And he is a firm believer, and I agree with him, that Lyme patients can get legitimate post-traumatic stress disorder from their experience, from all the doctors that told them they were crazy, from, you know, all the judgment and the criticism and the confusion and the misdiagnosis. And that's very, you know, traumatic. And so I do feel that that can play in as well. What I'm not saying, to be really clear, is, oh, it's just all in your head. It's not a, you know, you're not actually unwell. It's just all in your head. That is absolutely not what I'm saying. But psychological and emotional trauma can contribute to dysregulation of the limbic system. Chemical exposure can do it too. Toxins, mycotoxins, heavy metals, chemicals like glyphosate, like all the toxins that are in our environment, in our food, in our water. Chronic infections such as Lyme disease and co-infections, as well as viral infections, which is why we're having this conversation right now. Physical trauma, and really anything that's a stressor to the body can impair limbic system function. So what I want you to notice here is limbic system dysfunction can come from physical stressors, not just emotional stressors. Okay, so I'm just going to reinforce that point. So some people say, well, I've done talk therapy or cognitive behavioral therapy, or I've dealt with my emotions, or I journal, or I meditate, or whatever the case may be. And so they don't feel like limbic system dysfunction is their deal. But be clear, the physical stresses create limbic system dysfunction just as much as the emotional stressors. So by the same token, limbic system dysfunction manifests as more than anxiety and emotional symptoms too. It can manifest in a huge range of physical symptoms. So you see our dilemma here, right? We've got a chicken and an egg situation. Is the limbic system the thing that's creating all the problems in the body? Is the problems in the body creating the limbic system issues? Well, both, to be honest with you. And so that's where we need to break the cycle and rewire the patterns to get true healing and to get change. So when all those stresses happen and put all that strain on the limbic system, the net result is that the limbic system becomes very hypersensitive and begins to overreact to normal external stimuli. So things that one person might be able to tolerate, in somebody with limbic system dysfunction will be just, just overinflated, or just kind of so much more intense, I guess. So a heightened pain response, more inflammation, cognitive deficits, poor memory, brain fog, anxiety, depression, hypersensitivity to light, sound, smell, chemicals, EMFs, sleep issues, hormone imbalance, digestive issues. They can all be a response or a result of the limbic system having problems. And does this sound familiar to any of you? I dare say it does. So it's the hyperreactivity that causes so many issues with things that other people's body might be able to handle. Okay, so this is why I frequently see it with families and a husband and wife living in a house that's had water damage. And one partner may be really unwell and one isn't unwell at all. And so there's a lot of different factors that, can sort of go into that and what causes that. But part of it is, if somebody has a limbic system dysfunction, their responses to everything are going to be exaggerated, and they won't be able to tolerate levels of things that other people can tolerate. So how the program works, like I said, it's based on neuroplasticity. So it's based on rewiring the brain with healthier neural pathways. Because healthier neural pathways lead to healthier nerve signals, healthier functioning of all organs and systems. It's a flow-on effect. So in very simple terms, and this isn't really anatomically correct, but I always think of it like all the wires get tangled. Right? So if we think we want our neurons firing in healthy patterns, if they're all tangled and all, messed up, then they aren't able to fire in healthy ways. And so that's what we want to sort of untangle those neurons. We want to straighten out those pathways. It's kind of like defragging the computer, right? If your computer's slowing down, it's tripping over itself and, going around in circles, you could defrag it and then it kind of operates more smoothly after that. So just a couple of examples to tell just, little stories here. So I remember this is years ago when the DNRS program was kind of first on my radar, and I had a conversation with a father in Australia, and he and his daughter were both impacted by Lyme disease. And I talked to them about different treatment options and whether, they would treat with natural agents, herbals, antibiotics, whatever the case may be. And they had decided, based on their research, to not do any of that and to do the DNRS program. And sure enough, they both recovered. They both went into remission. Okay, just doing DNRS. And I can see I've got my letters mixed up there, but you see my point. I've heard stories like that from this program. So then more recently, in the last few months, I had a patient who had Lyme and Babesia, and I would add Bartonella too, and mycotoxin illness. So that's a very common combination in our chronic Lyme patients to have mycotoxin problems too. So this patient, we treated the Lyme Babesia fairly extensively and really kind of got those kinds of symptoms under control. But the mold sensitivity was profound and getting worse and worse. And so this poor lady couldn't be in her home anymore, got rid of her car, pretty much threw out all her clothes, but it wasn't helping. She was just getting more and more reactive. And her skin would burn when she was anywhere that had mold. And so she was trying different hotel rooms and different hotels, trying to find an environment she could exist in. And she decided to do this program, Annie Hopper's program. She was the developer of it. And really within the first month, she was reporting that she wasn't having the skin burning anymore, that she could be in different environments that, that she couldn't have tolerated 2 months earlier. And she was having pretty significant improvements. And so, it just reinforced to me how much this is working with physical symptoms, not just emotional symptoms. And that was a really great example. Interestingly, when she sort of backslid a little bit and wasn't as consistent in doing the program daily and the work daily, and I'll talk about what that means in a minute, she felt her symptoms were kind of, creeping back up again. So there is a certain period of time of committing to this program that is encouraged / required. And so I have seen that make a real difference. And then just recently, I was talking with a patient who has had Lyme disease for years and years and years, and is just very, very new to this program. But already she reported that she was feeling more hopeful. She was feeling less depressed. She was feeling less isolated. And so even within the first couple of weeks, I do see that people have things shift. I'm not saying a couple of weeks is going to get people well. It's a process. It's a commitment. It's a journey, just like anything else. But I have seen some good results in a relatively short period of time. So what does it look like, this program that I'm talking about? So it's either done as a 5-day seminar in person, and they are at various locations. Most of my patients who've done this program actually haven't gone in person just because of, travel and costs and the logistics of pulling that off as a chronically unwell person are challenging. So it is available as a 14-hour instructional DVD series or just streamed through the computer. And the encouragement is to try and cover that in a 4-day period, although if one needs to stretch it out further, that's okay too. But here's the important part. There's a minimum commitment of 1 hour a day of practical application for at least 6 months, right? So there's homework, folks, homework. And so I've talked to some patients about it, and they just weren't ready to commit to that. And I said, look, if you're really not ready to commit to that, I wouldn't even do the program. Like that's the deal. That's what you're signing up for. It can be broken into a couple of different sessions. So it could be 3 sessions of 20 minutes, 2 sessions of 30 minutes. It doesn't have to be all in one go, but that is the bottom line of, minimum an hour a day for 6 months. Now, these exercises or this homework combine speech, visualization, and full body movement. It's not vigorous movement. I understand that a lot of you don't have the capacity to do like exercise type activity. It's not like that. It's more just, full body movement, spatial relations, things like that. But really, through the neuroplasticity, we can train our brain to perform in more healthy ways. But it's just like exercising a muscle. Like, you wouldn't go to the gym and lift a weight and expect to have strong biceps the next day. It's not going to happen. You might have sore biceps the next day, but you have to just maintain that over time. And that's where the homework comes in, because it's a training effect, right? Just like we train for fitness or we train for strength, it is a training effect for this as well, to train our brain to operate in more healthy ways. So some resources for each of these 3. I'm going to guide you to websites or resources as best I can. The main website you want to go to here is called retrainingthebrain.com. And they also have a good self-assessment questionnaire that's quite handy. I've got the link in the slides, but remember, I am going to send you a summary of all these links and email addresses and phone numbers and such before the end of day tomorrow. So look out for that in your email. There's an email address. You can contact them through email, or there's a 1-800 phone number as well. And they're wonderful people. I've spoken to them on occasion, and they're really great. So the second thing I want to talk about is NRF1 and 2 activation, NRF1, NRF2 activation, also known as NRF1 and NRF2. So NRF1 and NRF2 activation is working on the level of cellular activation and cellular health. It doesn't replace antimicrobial therapy. Okay, so when we have a chronic infection with Lyme, we have to kill the infection. However, I've seen NRF1 and 2 accelerate healing, make all the other therapies work better, and most importantly, provide profound improvements in energy, cognition, mood, and sleep quality are some of the main things I hear about. But I get all kinds of reports about, psoriasis or eczema clearing up, depression lifting, better focus. I mean, so many different things. So what we're looking at here is getting the cells to work in more healthy ways. Just like with the DNRS, we're trying to get the brain, the neurons to work in more healthy ways. The NRF1 and 2 is working at the cellular level and actually at the gene level to make things work better. So some of the underlying challenges in Lyme patients, and this is also true, we're talking about Lyme today, but this is true for many chronic health issues. There's oxidative stress, which goes hand in hand with inflammation. So oxidative stress is also called free radical damage. It's what will ultimately damage cells and ultimately over time kill cells. Oxidative stress is also what aging is. Aging is oxidative stress. But we know it's accelerated in chronic infection and chronic illness. The second thing we know to be a challenge in Lyme patients is toxicity. And so that it goes from everything from not being able to detox because of methylation issues to, struggling through the Herxheimer reactions, and then also just the other toxins that tend to be accumulated, whether it be mold, heavy metals, pesticides, fertilizers, the list goes on. So toxicity is also something that we're always aware of. And then the third thing is mitochondrial dysfunction. And there are entire Lyme treatment programs built around mitochondrial repair. I definitely view it as an important part of, recovery from chronic Lyme. And so there are three underlying stressors and challenges that are present in the majority of my chronically unwell patients. And so the NRF1 and NRF2 activation work to correct all three of these things. So before we get into that a little bit more, I want to just touch on the difference between activation versus supplementation. So a lot of us supplement, and I'm not saying that that's necessarily a bad thing. I'm just trying to point out the difference. Supplementation is when we're topping up levels of a substance that may or may not be deficient in the body. It may be deficient like magnesium or B12, and we're just trying to top up those levels. Or it may be something that we're using for a therapeutic response, but we're adding something to the body that our body is kind of usually produces by itself anyway, but we're just trying to get higher levels of it. Activation is when we're literally switching on the cell's genes, right? We're triggering the cells to upregulate their own functioning. So it's kind of like, why would you go in a room and just light a bunch of candles? Like if you're in a dark room and you're lighting a bunch of candles to get light versus going to the light switch on the wall and just flipping the switch. And the lights come on. So it's like that. It's like we want to switch on those healthy genes and we want to switch off the unhealthy genes. And so again, this is where science is kind of catching up, and I love it. I geek out on this stuff. But we used to think, your DNA, your genes are your genes, and there's nothing you can do about it. Like you're just stuck with it. And now we know through this whole field of nutrigenomics, we know that we can influence how our DNA is expressed. So we might have certain genes and certain DNA and certain methylation issues and certain all of that, but we can influence how they're expressed, and we can influence which genes are on and which genes are off, kind of like switches on a big switchboard. So I'm going to start with NRF2 activation, and then we'll talk about NRF1 in a minute. So NRF2 activation has a few key features. It dramatically reduces oxidative stress, which, as I said, is free radical damage. And that causes so much cellular degeneration over time. Now, oxidative stress, think of it like you cut an apple and you leave it out on the kitchen counter. The flesh is going to turn brown, right? Because it's oxidizing. That's kind of how our cells, that's what happens to our cells too. If you think like your cells are rusting, which sounds kind of terrible, but that's what oxidative stress does. So we know that NRF2 activation, the researchers showed, reduces by an average of 40% in 30 days and up to 70% in 60 days. So it's pretty dramatic. It also boosts natural glutathione production by 300%. Now, if any of you know me better, you'll know I'm a huge fan of glutathione. I shove it down everybody's throat. It's so good for the brain. It's good for the liver. It's good for energy. And it's, there are still times where I add glutathione to the NRF2, but this upregulates one's natural production of glutathione. Glutathione is also a natural chelator, so it sort of helps to get heavy metals out of the brain and out of other tissues too. So the NRF2 also opens up detox pathways to enhance detoxification. And I know in Lyme we're always looking at ways to detoxify, and that's such an important part. But the NRF2 does it really on a gene level. And so it does help with MTHFR and other gene mutations. You get more positive gene regulation and expression, right? More healthy gene regulation and expression. So this NRF2 synergizer is what it's officially called, is a blend of 5 herbs: milk thistle, ashwagandha, curcumin, green tea, and bacopa. And all those herbs have really great properties. And what's really nice about it is it's unique in the way the herbs are combined to have a synergistic effect. So you can see in this table, the actual individual herbs are not in crazy high doses, and it's not, 6 pills a day to get the full dose. It's literally 1 tablet per day. But if you look here at the synergistic effect, it's 18-fold increase expression of the antioxidant gene. Okay, so you see the control there over on the far left, the purple is the control. And then you've got the ashwagandha, bacopa, green tea, silymarin, which is milk thistle, and curcumin, which when you look at them one by one, you go, okay, whatever. But then you see them all together in that very specific ratio, and it has a much, much more profound effect. And so, so we know that the sum is, is the whole thing is more effective than all the individual parts listed individually. And I have actually had people say to me, well, I take all of those herbs. I take those 5 things all separately. So, why would I do the Nerf2 Synergizer? And I explain this about the synergistic effect, the ratios. And I actually have a dear friend of mine. She's an acupuncturist and health coach. And she was taking the 5 herbs individually and then switched to just 1 tablet a day of the Nerf2 Synergizer. And she said, I really feel a difference. Like I can see my liver is functioning better, sleep improved. And she was like, thanks for saving me like $200 a month on these individual herbs. So the Nerf2 Synergizer has 7 patents. There are 24 peer-reviewed studies in PubMed. So PubMed is like the library's clearinghouse of all the medical research, the government clearinghouse. So to have 24 peer-reviewed studies is fairly significant. And there's also third-party research done by a ton of different institutions. This is just an example, but the NIH, Johns Hopkins, Vanderbilt University, Harvard University, Louisiana State, and the American Heart Association. So it's very solidly backed in science and very credible based on the results of those studies. So let's jump on to NRF1 activation now. So NRF1 activation, the primary target is mitochondrial repair. Okay, so we can actually heal the mitochondrial damage and we can create new mitochondria, which is really cool. So the mitochondria are the powerhouses in the cell that convert food energy into cellular energy. And our cellular energy currency is ATP. Right? There are units of fuel, kind of like our units of money are the dollar, depending on where you live, but let's just say here. So a dollar is to money as ATP is to our energy. Okay, so when we say energy, we just use that as a general kind of expression, but what we're really talking about in biochemical terms is ATP. So having sufficient ATP does contribute to your sense of energy. Absolutely. If you have mitochondrial damage, you'll feel fatigued. Your muscles will feel weak. You won't have any exercise tolerance. You won't have any stamina. So definitely the way you feel. But just as important, ATP is what drives every cellular and biochemical process in the body. So it's kind of like you can't drive a car if you don't put the petrol in or the gas in. And it's like that. You can't drive your cell's performance if you don't have energy to put into that pathway. And so this is where mitochondrial repair is so important. And looking at lists of diseases that are associated with mitochondrial dysfunction, it's, again, really significant. But the dysfunction is also a consequence of chronic illness and chronic infection. So what we need is to introduce micronutrients that repair the mitochondria, boost energy, and fuel our other metabolic processes. So the way I like to break it down here, just to be really simple about it, is the NRF2 upregulates detox and reduces oxidative stress. The NRF1 heals the mitochondria and boosts ATP production. That's kind of the bottom line. But how I think of it is the NRF2 is taking out the trash, right? It's detoxing, it's cleansing all that crud out of the cells. So the NRF2 is about taking out the trash. The NRF1 is providing the energy for the NRF2 to take out the trash, right? So when you upregulate detox and you upregulate the antioxidant capabilities of the cell, the NRF1 provides more ATP to keep up with that process. And that's why they go so beautifully together. The third thing I want to just mention, we're talking about NRF 1 and 2. This is, we call it NRF 2 activation for the brain, but it warrants mentioning because I've seen it make such a difference in Lyme patients, especially with cognition, mental stamina, things like that. So Axio is targeted brain nutrients. It comes in a powdered drink. It's individual sachets. There's caffeinated, there's decaffeinated, there's a range of different flavors, but it provides a physical energy boost, but also, and almost more profoundly, a mental energy boost. So it's all about focus, it's all about concentration, it's all about mental stamina. And as such, I've also seen it profoundly help kids either, with learning disabilities, autism spectrum, ADHD, I mean, the whole gamut. Like what I've seen in kids is just blows my mind. And that's not even related to Lyme. That can just be about other kind of issues that our kids today, face so frequently. So like I said, caffeinated or decaf. So it's not about artificial stimulants. Some people do well with the caffeinated version. My thought in Lyme has always been, if you're chugging 8 cups of coffee just to get through the day, then that's not a good thing. That's obvious that your adrenals are so depleted and you just need the stimulant just to kind of function. However, for people that just sort of do well with, 1 dose of caffeine per day, I've never really had a problem with that. I tell people, look, have your latte in the morning if you want, or if that's, have your green tea, whatever the case may be. So I don't believe that energy drinks, which a lot of them out there are so artificial and so chemical and so laden with sugar and yuck. But a lot of them just work by giving so much stimulant that, everybody gets completely hyped up. And so that's what I like about the Axio. It's not like that at all. It's nourishing for the brain. It does provide some B vitamins. It provides a range of different nutrients. But it's not artificial stimulants, and it's not really, really overstimulating. Obviously, anyone who's very caffeine sensitive is going to want to choose the decaffeinated version. That's fairly simple and common sense. But it does help with cognitive function throughout the day. And I can even say, God willing, my brain fires fairly well on the average day. But when I'm busy with patients all day, or if I've got like higher demands, you can bet that I'll be drinking an Axio. Just to help kind of with that focus and that mental stamina and that concentration. The other thing I like about it is it does contain L-theanine. And L-theanine is an amino acid. It's used a lot for anxiety, and so it's very calming. It's sometimes used for sleep as well, in conjunction with GABA and some other things. But the nice thing about theanine is it's calming and it takes the edge off anxiety. So like I said, where other stimulant, kind of artificial stimulant energy drinks, which I don't even really want to put this in the same category, but some of them are very anxiety provoking just because of that stimulant nature. Axio helps with focus and helps with concentration, but in a calm way, like calm focus, calm energy. It's not like chaotic, overstimulated energy. And so I've seen it be really, really profound for some of my patients. So the winning trio in my view, and what I also like about this is it's not tons of pills to take. The NRF 1 Synergizer is typically 2 capsules per day. The NRF 2 Synergizer is typically 1 tablet per day. Now, I will give you a caveat on that some people do detox a little bit in the beginning because it opens up detox pathways, right? So what do? We get more detoxification. Sometimes that can be a bit bumpy in the beginning. So just being aware of that is key. If you're really sensitive, you could start with 1/4 of a tablet a day or 1/2 a tablet a day and just work up gradually. But anytime I've seen that, there's that sort of that tipping point, you get over the hurdle and then things start functioning better. But I will say that the NRF 2 can boost that detox. And so some people feel, a little headachy or more fatigued or, just a little bit rough for the first, few days to a week, and then it usually passes. So then the Axio Brain Formula is just 1 sachet daily. I have some parents that give it to their kids on school days and not on weekends. I have some patients that just sort of take Axio as needed. I have some that take, 2 or 3 doses a day because that's what gets them through. So the Nerf 1 and 2, it's more important to be consistent. And but the Axio tends to give a more immediate boost because it's giving those brain nutrients. If you imagine with oxidative stress and with the mitochondria, those things don't happen overnight. Cellular damage doesn't happen overnight. And, looking at many of you and how long you've been infected with Lyme disease and how long you've been unwell, that's quite a process. That's quite a beating up that your bodies have had. And so to be realistic about it, we always the rule of thumb, in my view, I always say, if you're going to do Nerf 1 and 2, commit to at least a 3-month trial, because it takes time for those things to be repaired. And then there's another rule of thumb that I've heard that says, take it 1 month for every decade you've been alive, right? So if you're 50, it's a 5-month, really give it 5 months to do its full thing. Now, we know from the research that it starts working a lot quicker than that in the body. And I have lots of people who come back and say within a month they feel better, they've got more energy. I have one lady who came to see me and she goes, I had no idea I was so depressed. She said, I thought I was just traveling along okay, but since I've started the Nerf 2 and the Nerf 1, my depression is lifted, but I didn't even realize that I was depressed. And so it was sort of like the sun came out and the clouds cleared, and and that happened within 2 or 3 weeks. So it can go both ways, but I always want to set realistic expectations. I'm not going to say, look, take this and a week later you'll be like jumping up and down. But I have seen it make a profound difference in my patients. And again, as I said at the beginning, it's not replacing antimicrobials. I still either do, antibiotics, herbal antimicrobials, essential oils for antimicrobials, whatever the case may be. We've got some good tools for that too. This is more about correcting the damage that's happened to the cells over the years and also preventing problems in the future. So I take Nerf 1 and 2 every single day, and I will do for the rest of my life. My husband takes it. He had arthritic pain in his hands and high cholesterol, both of which have improved. My 5-year-old daughter takes it. She takes, half a tablet a day, which is appropriate for her size, and so it's just as much about prevention of problems over time because of how many issues are associated with oxidative stress and mitochondrial damage and toxicity in the body. So it's kind of like a bit of an insurance policy as well. So resources for this. So for the product information, you can click and look up the different things. I've got the website for that. If you're in a different country, just click on the flag in the left-hand corner of the screen and select your country. So I know, for example, the Axio is not available in Australia. I do have a couple of people that I just send it to because they like it and it helps them. And we haven't had any problems doing that with customs and whatnot, but in terms of just ordering directly. But it is available in most countries, certainly the UK and Canada, United States, etc. So that's the central website. No matter what country you're in, just make sure you click on the flag on the upper left corner. And so if you wanted to start on Nerf 1 and 2 and start on Axio, that's the link that you would follow to order. And I wanted to just add a little gift for people who are listening to this webinar, whether you're listening live or the replay. But I love the Axio. So with any order of the Nerf 1 and 2 combination, I will send you 7 little daily sachets of Axio. So once you've placed your order, just shoot me an email, let me know. I have the red raspberry here, which is a little bit sweet. It's the decaffeinated one. And that's really great. And if you do order Axio at the same time, still email me. I'll still send you 7 sachets. Maybe I can come up with a different flavor for you to try or something like that. The other thing I want to let you know is there is an educational Facebook group that has lots of information, everything from what is Nerf 2 activation, what is oxidative stress, how does this work, and then there are educational modules on a variety of different health conditions. So there is a module there about Lyme disease. There's one on depression, anxiety. There's one on kids, like ADHD, learning disabilities. There's a host of different information in there. And it's just a Facebook group. I've put the link there. It probably will ask who suggested you join the group, because we're, pretty conscious of, how do I say this, not having like FDA and whatever in that group, because then we're censored in actually telling the truth about health stuff. I'm sure you understand. But anyway, it's a great group, lots of information, so you can jump on in there. So let's move on to number 3. And this is a medication called Disulfiram. It is also known as antabuse. And I want to be clear and absolutely honest with you. I am not yet prescribing this medication. I'm still learning. I'm still researching. Within our ILADS community of doctors, we do have a discussion group going about this topic and about this medication. There's also a patient-centered Facebook group. I've got that link for you in the resource section as well. So I'm not pretending that I've been doing this and I can tell you everything about it. What I'm going to present to you tonight is the information that I have accumulated so far. And obviously, if and when I start prescribing this medication, I will continue to update as I get more firsthand experience. But it is there's a lot of buzz about it in the Lyme community. And so I definitely, in terms of updates, I think it's very relevant and a valid thing to talk about. It's still early days, so we'll just have to see where this goes over time. So Disulfiram on label is used to help with alcohol addiction and abuse. Okay, so it works by making the person who takes it incredibly sick if they have any alcohol when they're taking the medication. So it works by inhibiting the enzyme acetaldehyde dehydrogenase. And I'll show you a little diagram in the next slide, but that enzyme breaks the acetaldehyde down to acetic acid. Acetaldehyde is the compound that's responsible for hangovers. And so that's why it's used to curb excessive drinking. So you can see here, and I get that this slide is a bit fuzzy, so I apologize for that. But ethanol or alcohol is broken down to acetaldehyde by an enzyme called alcohol dehydrogenase. And then it's broken further down to acetate or acetic acid by aldehyde dehydrogenase. So if we inhibit the aldehyde dehydrogenase, acetaldehyde builds up, and that's the compound that gives rise to the headaches, the hangovers, the feeling, awful after having too much alcohol. It's just that with this medication, any little bit of alcohol is going to provoke that sensation, that experience. So what's interesting here, and this is where it gets relevant, is studies show that the medication also has antimicrobial activity. And it's been shown against gram-positive bacteria, including some staph and strep, as well as Plasmodium falciparum, I never know how to pronounce that, which is the pathogen that creates malaria. So this is where it gets really interesting, that all of a sudden this medication used for alcohol abuse is shown to have antimicrobial properties. No one really knows yet how that happens, like what the mechanism is of that. But there was a study that compared 4 different antibiotics: doxycycline, which we know is used extensively in Lyme treatment; ceftriaxone, which is IV Rocephin. It's given mostly intravenously. It sometimes can be given intramuscular or IM. But when people do IV antibiotics for Lyme, it's usually ceftriaxone that they're given. Vancomycin, which we know is effective but pretty heavy going and fairly big side effect profile. And Disulfiram against Borrelia burgdorferi. And interestingly, the Disulfiram reduced bacterial cell numbers most effectively and most dramatically. Where it gets really cool is it also eradicated persister cells, which may be one of the causes of the chronicity of Lyme. And this is kind of one of the things that if the National Institutes of Health would actually grant us some research, thank you very much, we would understand this better. But the persister cells, they get very deep in the body, and they're very hard to eradicate with the majority of the antibiotics that we're using. And so there are different protocols, and I know Dr. Horowitz is using rifampin and dapsone and different combinations like that. Dapsone I don't prescribe because I'm not willing to manage the side effect profile. I know he believes that it's effective. However, I've had some patients come to me that had been prescribed it, and they were like really having a difficult time. They just couldn't get through the side effects. And so it's a medication that I find a bit intimidating, to be quite honest with you. But the persister cells are definitely an issue. And so the fact that this Disulfiram medication seemed to address that is really significant. And so here's the chart. You can see the cell numbers on the vertical axis and the drugs or the medications on the horizontal axis. And so you see the cell numbers with no drugs or no medications, and then with doxycycline they come down, with ceftriaxone they come down, with vancomycin they come down, but with disulfiram they come all the way down. And so that's why we say it's kind of leading the pack in those particular antibiotics in reducing the Borrelia cells. But what does that mean for co-infections? We all know that co-infections are a huge part of chronic Lyme, and I've always said that I feel like when people aren't having good recovery from Lyme with their standard treatment, missing co-infections is always something that I've been hyper aware of, and I'm very, very big on that from the beginning. And I have a couple of tools, not only doing lab testing with a couple of different labs, but also I do a herbal co-infection provocation to try and tease out, Borrelia versus Babesia versus Bartonella. So they're the sort of the three biggies that I'm always on guard for. So we know that the disulfiram is effective against Plasmodium, which is a cause of malaria. So it follows then that it could be really effective against Babesia. What we're really uncertain of at this point is the efficacy against Bartonella. And so what I'm gathering so far is there are still some people who are taking Bartonella-focused antibiotics along with the disulfiram. Now, we don't know yet if that's a good idea or not. However, there is a concern, like generally speaking, that disulfiram is done as a standalone antibiotic, not in combination with other antibiotics, as we've usually done in Lyme treatment, right? We usually make sure we've got a spirochete med and a cell wall deficient med and a cyst form med to feel like we're covering all the different forms of the Borrelia bacteria. With the disulfiram, typically it's not done in combination. Typically it's just that by itself. The only deviation from that I have found so far is some of the folks for whom Bartonella is like the biggest issue. It's just unclear as to whether the disulfiram is going to do enough for that. And so there are still some people who are combining it with, rifampin, Bactrim, those kinds of medications. So let's talk now a little bit about how it's taken. So the one thing that's coming out as really crystal clear is that this medication can cause significant Herxheimer reactions. So the dosing schedule is very slow and very gradual. And, as I'm following the groups and talking to the couple of different doctors who are using this medication, the reports of Herxheimer reactions are like so much more than other medications we've seen. Now, if you look at, think back to that table and the efficacy of the medication, that could be just a natural response to it being so effective. But a lot of people are having a really, really hard time with it. So like I said, most of the time it is a standalone treatment. Where it gets a little tricky, and again, this is what, time and experience will give us as a group of, Lyme practitioners and patients, but this is a question that crosses my mind. What's the risk of stopping other antibiotics that, may not be bringing a person to recovery, but maybe holding them steady at a certain point? And so, if we pull those antibiotics to switch to the Disulfiram plan, could things kind of unravel or at least slide backwards briefly until the Disulfiram dose is high enough to kind of kick in and have its effect? So that's just a question I'm raising. I don't think, any of us really know that for sure, but that's one of the considerations I have. I also have probably half a dozen patients of mine in my mind right now that I would love to introduce this medication to, that have done a lot of antibiotics and that have had, a fairly significant level of improvement, but then just sort of plateaued. And so I think maybe that is a good opportunity to come in with something different like this as well. Again, one of the sort of challenges we have is some of those patients that I can think of mine are really like Bartonella is their stubborn co-infection. And so that's kind of what we're still navigating along the way. So the dosing for this medication starts really low. So let's say a full daily dose is 500 milligrams a day. It could take weeks to get to that point. So the recommendation is to start either at 62.5 milligrams or at the most 125 milligrams every 3 days, and then kind of build up, like, I want to say fortnightly. My Australian friends will understand what I mean. Like every 2 weeks, kind of incrementally increase the dose. And so you can see going from 62.5 milligrams or 125 milligrams every 3 days, getting up to 500 milligrams daily could conceivably take a long time. I mean, weeks at least. However, what I've gathered is that people who do push it a little bit too quickly have a really hard time, have debilitating Herxheimer reactions. And that kind of just slows everything down in the end, because then they've got to kind of backpedal and do everything to support detox and kind of do what they can to get themselves back in a manageable state. So cautions about this medication: herxing, profound. I've already said that. That's probably number one. And it's interesting because when you look up, it depends on sort of what you read and what you look up. I mean, some sources say this medication's been used for 70 years. It's really safe. It's got a very low side effect profile. No big deal kind of thing. So long as you don't drink on it, no big deal. And yet the experience that I'm noticing Lyme patients have doesn't reflect that. It's a lot more difficult road. So the herxing I would consider the first thing. Checking liver and kidney function every 2 to 4 weeks. I mean, I always check liver function monthly, no matter what, for patients on antibiotics. I would say at least in the beginning, checking those values every 2 weeks is probably prudent, just to make sure the body's tolerating it okay. And this is key, which it sort of makes sense if you think about it: total alcohol avoidance. And so most Lyme patients, or most of my Lyme patients anyway, are very alcohol intolerant. And so they just don't drink because it makes them feel just rubbish anyway. But where we need to pay attention is also herbal tinctures. So a lot of herbal remedies, liquid herbal remedies, do have alcohol, both as a preservative, but also alcohol extracts the active ingredients, or some of the active ingredients from the plants. And so any herbal tinctures that are preserved with alcohol are out. And also you'd be surprised how many personal care products have alcohol. And then anything that can create alcohol in the body, like fermented foods, like proper real kombucha, actually does contain trace amounts of alcohol. And so all of those things are out. And what I'm learning too is there are some people who are taking this medication who aren't even tolerating vinegar and things like that. And so everyone's different, and the conversation is, but hang on, people who are taking this medication for alcoholism, they don't get sick when they have vinegar. Why are we getting sick when we have vinegar? And not every Lyme patient is, but I guess my point is there's various levels of sensitivities as to how restricted one needs to be with shampoos, any personal care products that may have any traces of alcohol. And like I said, you'd be surprised how many do. But also things like vinegars and, other substances like that in the body. Detox is still vitally important. So there are herbal remedies that are preserved with glycerin. And so sometimes the tinctures are available with a glycerin base, not an alcohol base. So that would still be an option. Glutathione, we've already talked about, one of my favorite things. A liposomal glutathione would help. The Nerve2 Synergizer would absolutely help because it's a tablet, and so it's not preserved with alcohol. And so detox is still a primary consideration, even more so in some ways with this medication than some of our other antibiotics we use. And so that has to be at the forefront and becomes even more important than ever. So just to note then about like the research and experience, so we don't have any human or animal studies as yet. Dr. Fallon at Columbia University is proposing a trial, so that'll be great. We'll have more information, but I do know like a lot of our information comes from the experience of Dr. Kenneth Liegner. He's an East Coast LLMD, medical doctor, and he's been using this medication for a couple of years. And so he's been very gracious in sharing his experience with other doctors who are looking to start prescribing it. I know some other kind of well-known Lyme doctors who are also starting to utilize this medication. So it's kind of getting out there, but it is early days. And I know that that's really hard for you guys as patients. And it's easy to feel like, you want something new and novel, but then you feel a little bit like a guinea pig, and does anyone really know what this is doing and how is this going to end up? And there's a lot of unknowns, and I understand that that's a hard place to be. But there are also people who are like, you know what, I've tried the other antibiotics. They didn't work for me. I'm really keen to do something different. I'm willing to take it slowly. I'm willing to kind of walk through the Herxheimer reactions. And for some people, that's worth it. So I would just encourage you to sort of keep an open mind on that. Like we as doctors, and I've seen some comments about, oh, what are these doctors? They don't know what they're doing, and they don't know, like they don't know this medication. And it's like, no, we don't, but we're learning and we're going slowly, and we're all trying our best. There's not a ton of research when it comes to chronic Lyme. And so just trust that the Lyme literate medical community, we're looking at this sort of with critical evaluation, but also, we're looking for things that can help you better as well, that go beyond the limitations of some of the antibiotic therapies that we've had available to us so far. So I think let's all just keep an open mind, be cautiously optimistic. There is no magic bullet. There's no one thing that like, this is the next cure for Lyme. I don't buy that for a second. Or I think it's an unreasonable claim to make. So if it turns out to be the thing that really breaks the cycle of chronic Lyme, then hallelujah. And, praise God for that. But right now we're still very much kind of, in a trial kind of phase. So I would encourage you just to kind of recognize that. So resources here, obviously Disulfiram is a prescription. It does require a prescription from a doctor. I do not encourage you to just kind of wing it on your own on this. I have read about some people who are doing that. They do not have access to a Lyme literate doctor who is willing to prescribe. I understand everyone's on their own journey. Everyone can make their own decisions. My encouragement would be to try and work with a Lyme literate practitioner who at least has access to the information, at least has access to people to ask about certain side effects and things like that. There are some side effects to consider. There's some neuropsychiatric side effects that may not be super common, but there are things to navigate. So I have put this link to the Facebook group But I want to be really clear. This is predominantly a patient group. It was started by somebody, an individual who has been using this treatment, and there's a lot of knowledge and experience in there. But again, I stress, it doesn't constitute medical advice. And so just, feel free to go in there and learn. I have, just to be clear, I've checked with the moderator, the admin of that group, and got her permission to put this link in the webinar tonight. So she's happy to have you guys in there and just learning, along the way. And I would encourage you to do that, but recognize it's a patient group who are sharing their experience, but there is some good, useful information. And Dr. Liebner is in that group too, and is very gracious about sharing his experience and sharing information. And then we have access to him through our iLads channels to get more information and just learn more along the way as well. All right, so how are we going for time? Did pretty well, about 5 minutes over time. So that is the information I have to present to you. What I'm going to do now, if I can get this part right, is stop sharing my screen and have a look at some questions. Let me just quickly look at comments before I go to questions. Oh, I'm so sorry. So yeah, Kathy, iLads is International Lyme and Associated Disease Society. Their website is ilads.org, and it's a professional organization. Lyme literate practitioners can become members of that. They have conferences at least once a year. They also have published treatment guidelines. And so that's kind of the organization that pulls together practitioners who recognize and treat chronic Lyme. So it's a great source of information. It's kind of like, the iLads are the group that's on our side. And they're trying to also work to educate, because the Infectious Disease Society of America so downplay the possibility of chronic Lyme. And so that's kind of what we're up against when we're treating and when we're navigating this world of chronic Lyme disease. That the IDSA only recognizes acute Lyme. 2 to 3 weeks of antibiotics will knock it out. Anything beyond that is just like post-Lyme syndrome that's not ongoing infection, where we do not believe that to be correct. All right, so there's a comment here about green tea ending up in liver failure. That is a very, very unusual situation. So, I know there's always kind of wild stories about an individual that had some reaction to something. Green tea is typically used as an antioxidant, and I've never seen any adverse effects from utilizing green tea. Let's see, continue, yay. Terry's saying started the NRF and got constipated. Any ideas on why? Again, that is not something that I have seen with it. I've seen detox reactions, not so much constipation. I would maybe consider individual sensitivities. Like, I don't know if you've taken those herbs before, if there's anything that you're inherently sensitive to. Or if that's just sort of the onboarding process. In that situation, I would have cut the dose down to, a quarter or even an eighth, just got a little pill cutter and reduced it dramatically, and then built it up very slowly. So I have a question here about correlation between chronic Lyme and mast cells. And yes, there is. So remember when we were talking, so mast cell activation, just to give a little background, is when the body is producing too much histamine. And so it's starting to get like hyperreactive to things. And I have seen there is a subset of Lyme patients that do have that kind of reactivity. I would trace that back to the conversation that we had when we were talking about the DNRS, that if one's immune system gets triggered and there's lots of stressors there, and then that turns into limbic system dysfunction, then that could explain the mast cell activation syndrome or the mast cell disorders. because again, it's a hyperreactivity. And a lot of people with Lyme do have this sort of these histamine responses. They become intolerant to a lot of foods that they could tolerate before. They just get hypersensitive to EMFs. They get hypersensitive to chemicals, to scents. And I feel like the histamine responses are kind of in that same category. It's like the immune system's gone wacky, the nervous system's gone wacky. And so, you know, it's just all part of that. So that's where I think the DNRS program would be very helpful. The other thing you can do is mast cell stabilizers like quercetin and nettles and vitamin C. Sometimes that's enough, sometimes it's not. There is actually quercetin in the NRF1 synergizer, but sometimes those kinds of nutrients can just quell that histamine response. And then some people actually do like histamine blockers, so your medications. And that's a little bit more the pharmaceutical approach, but I have had people who've had relief from that. And then just looking from a diet standpoint, a low histamine diet. And I'm trying to remember the website. I feel like, you know what, maybe if that comes to me, I'll put it maybe in the email or something like that. But there's a really good website. It's like the lowhistamineDiet.com or something fairly obvious that talks about foods that are high in histamine. So that's one of the things you can do as well, as just watching you're not, you know, taking high histamine foods in. So another question, DNRS sounds like the underlying cause for dysautonomia, specifically POTS. Is there a connection? I actually would see it the opposite way. So I would see that dysautonomia, you know, with the POTS, which yes, you're correct, a lot of people with Lyme have, is another reflection of limbic system dysfunction. So I would think, Danielle, that the DNRS would help to heal that and not cause that. Because POTS and dysautonomia to me is a classic sign of limbic system dysfunction. So are NRF1 and 2 medications available over the counter? Yes, they are natural supplements. That link that I put in that slide, and I'll put the link in the email that goes out tomorrow, is a link that you can purchase from. You can order from there if you would like to do that. So that link was in the slide. Maybe I will get it in the chat. I don't know if I'm clever enough to do that while I'm here. Let me see. Bear with me just a sec. Oops. Oh. Okay. I put that link in the chat, so you've got it right there. Danielle, if you're in Australia, just reach out to me by email. I've done that for a couple of people. It's fairly straightforward. I've never had any trouble getting it in through customs. So just reach out to me on the email that you got the notifications about the webinar. Let's see. All right, Carrie, thank you so much. Are you familiar with Vasper? No, I'm not. Actually, Carrie, I'm not. So if you have any information you want to share with me about that, you're welcome to email me about that too. Oh, John, you've got a juicy question. So many in the Lyme community say some very large corporations are lobbying against any Lyme research being done. Do you know who is funding this anti-Lyme lobbying? What's your opinion? Well, I don't, to be honest with you, and that's a whole rabbit hole. And, you know, I'm torn. I try to I stay in my lane, right? So my priority is the clinical work, helping people one-on-one, getting information out. I'm not very political in nature. I'm not really conspiracy theorist in nature. It's just kind of not my way. And so I put my energy into just the clinical work. So I probably don't have my ear to the ground on things as much as some other people may. Having said that, I agree that there's something really not right going on with the denial of chronic Lyme and the Infectious Disease Society of America's position on it and the lack of research. And so I think eventually that information will become clear. I don't know what the answer to that is. I wish I did, and I wish it wasn't the case. You know, I wish that if indeed that's happening, that it wouldn't be happening, because so many people, such as your beautiful selves out there, are suffering. And it's, you know, it's hard for practitioners too to navigate and learn and really kind of get a sense of what the optimum things are. And I know that comes across for you guys as you're kind of like, you know, the guinea pigs. And I'm really just hoping and praying that one day that changes. Danielle also questioned Disulfiram on the microbiome in the gut. Well, that is a good question. And I would say that, I mean, again, that's unknown as yet, but I would say anything that has the ability to kill bacteria could potentially also kill healthy bacteria in the gut. So I think we need to treat it just as we treat our other antibiotics, meaning, you know, replenishing good gut flora and really kind of working on that, separating probiotics from the medication by at least 2 hours, watching sugar intake, watching carbohydrate intake, all of those kinds of things I think would still apply to this. Yeah, so anonymous, but good question. Right, so the question is, does Disulfiram only cause a reaction in Lyme/Babesia patients? And there, it does seem, and this is what I mentioned a little bit earlier, it does seem that there is a heightened sensitivity in Lyme, and by Lyme I mean like Lyme co-infection patients, to the medication that makes them more sensitive to things that other people who are taking the medications are not sensitive to. So somebody who's taking the medications for alcoholism and not for Lyme, I mean, we've never heard that they can't tolerate vinegar. We've never heard that they need to change all their personal care products. Like, those people may be out there, but that's not something that's commonly regarded about the medication. Whereas it seems to be that in more of the Lyme community. So yeah, I mean, even avoiding Purell, yes. I mean, hand sanitizers that are really have a lot of alcohol in them, yeah, I think they do need to be avoided. And so it seems like there's something about the relationship between using Disulfiram in Lyme patients that does create a stronger reaction, because other people take the Disulfiram, like using it on label for alcoholism, take the Disulfiram without those strong negative reactions. So, you know, whether that's pure Herxheimer reaction or whether there's another level of sensitivity that we don't fully understand yet, I don't think it's strictly a drug reaction, because thousands of people have taken that medication for years and we haven't seen, you know, that kind of response in that population. So there does seem to be something a bit different here. Whether it's fully Herxheimer, I think is yet to be seen. Sharon, I did say that Axio wasn't available in Australia, but I can get it over there. It just means that we just have to do it privately. I'll just send it over. But the Nerf 1 and Nerf 2 synergizers are both available in Australia and shipped within Australia. Carrie's asking, do chronic Lyme and co-infections affect red blood cells and or iron levels? Yes, in a nutshell, yes. The red blood cells I've seen a little bit less so. White blood cells I certainly see being suppressed in chronic Lyme because it is sort of inherently immune suppressive. Iron levels I see more related to Babesia. So Babesia is a protozoa or an intracellular parasite. It lives in the red blood cells and it can destroy the red blood cells. And so then that sort of, you know, leaks iron and reduces the iron supply. So in my Babesia patients, I've seen a lot of iron deficiency. Interestingly, it doesn't always show up as low red blood cell count or, you know, hemoglobin, hematocrit, other markers of iron deficiency anemia, but I do tend to see low iron levels. Let's see. Gabriella, information on Disulfiram and mast cell activation. No, haven't seen anything. I haven't seen anything relating to that at this point. Alvita, best way to order Nerf 1 and 2 and Axio from Australia. So just jump on, follow that link that I put in the chat. Click on the flag on the upper left corner and select Australia. And you can go ahead and order the Nerf 1 and Nerf 2 directly there. So it'll be with you within a couple of days. And I always recommend starting one thing, start the Nerf 2, give it a week or 10 days, then add the Nerf 1. And so if you ordered it, and then if you wanted me to send you some Axio, it would just kind of graduate the starting process, which is probably a good idea anyway. Let's see. Yeah, Kelly, I'm just following your comment in the chat. Yeah, Lyme does make one more sensitive to alcohol. So I guess, if you're then adding a medication that makes you more sensitive to alcohol, it all just kind of snowballs. It's hard to know how much is that and how much is Herxheimer reaction. And it's probably an element of both. So we're probably seeing a couple of different dynamics going on. The best we can do is really strictly avoiding the alcohol and alcohol-related products, and then supporting detoxification as much as possible. All right, boys and girls. So I think I have hit most of these. Jody's asking, wonder how the DNRS compares to something like Clear Mind Neural Retraining. Yeah, I don't have a ton of experience with other things. I have done neurofeedback in a subset of patients. And I have found the neurofeedback to be helpful for more of the cognitive and the emotional and psychological symptoms. I don't necessarily see the neurofeedback flowing over into the body working better and the physical symptoms improving so much. So that's where I think the DNRS does kind of get deeper and have a more profound effect. Let's see. Yeah, Kathy, okay, yeah. So you were told your Lyme titer came back negative, but you're having some of the symptoms, or a lot of the symptoms that we're talking about. You were borderline lupus, now negative. Yeah, so if you're concerned that you actually have Lyme but are being misdiagnosed, I would strongly encourage you to pursue further testing. And it's hard to tell from that if you had just general ELISA test, or if you did testing through IGeneX or DNA Connections or one of the more specialty labs. But yes, I would try and get with an ILADS doctor. And we talked about ILADS before, and I mentioned the website is ilads.org. Let me see if I can get this in the chat. ilads.org. So I've put the link in the chat. They do have a referral system. So you can contact them and they will give you doctors in your area if there are indeed, ILADS trained doctors in your area. I also do a lot of long distance work with people. I do phone and Skype appointments. So, reach out to me if you wanted to inquire about that. We can certainly make sure, review the testing you've had, make sure you've got the right testing, and order any further testing. The only thing I can't do with patients if we're working long distance is I can't prescribe anything without having a visit, face-to-face visit in my office in California. And that face-to-face has to happen at least once a year. Okay, last question I'm going to field, and then we are going to ring off for the evening, or if any of you are my Aussie friends, it's going to be morning and you can go out and enjoy the crisp, chilly day. So just my opinion on liposomal antimicrobial tinctures versus non-liposomal. Excuse me. I personally do like liposomal formulations. I use, and I know this isn't antimicrobial, but I use a lot of liposomal glutathione. I use liposomal vitamin C. Biocidin makes a great liposomal formula, Biocidin LSF. And so I do think the liposomal form makes them absorb well. They've got a little fatty acid coating around each molecule, so it crosses through the cell wall more easily. They absorb across the mucous membranes rather than having to be fully digested per se. So yes, I do like them. There's lots of antimicrobial tinctures that are not available liposomal that still have, very, very effective results. But generally speaking, I do like liposomal formulas. All right, everyone. So, oh no, we've got Now we got more questions. Whoops, I missed those. Okay, let me see if I can just do this quickly. Okay, so Gabriella, Axio is actually A-X-I-O. I'll put it in chat, except it wants to correct to access. So Axio is the name of that product. Yeah, Ashley, the IDSA guidelines advocating for reducing antibiotic treatment to 10 days after a tick bite and positive test. Even if you get a bullseye rash, if your test is negative, no antibiotics is suggested. It's just getting worse and worse, in my view. I think if we're looking on the bright side, I'm hoping that because there's more recognition of Lyme and there's more information out there, and with social media, there's so much sharing of information, that people are getting more aware that they need to look further. I had 2 new patients just this afternoon who were acute Lyme, and I'm in San Diego. I don't see a ton of acute Lyme, but I saw 2 patients just, a couple of hours ago that had recent bites and were, very aware of how to deal with it. So I think it's horrible if the IDSA is getting more and more restrictive. It's not doing anyone any favors, but we've just got to try and get word out so that people know to question that and people know to do something different. Would you start the Axio after the NRF? Danielle, I don't have a strong thought one way or the other on that. My guidance would be just start one, as with anything, start one first and then, a week later, start the other one. The NRF2, like I said, it can be a slower process for people who are sensitive and have more detox reactions, whereas Axio tends to be a little bit more kind of instant gratification, but it works fairly quickly. So I would just, you can do both together and they work beautifully together. Just choose which one you're going to start with. All right, guys, I think we are going to have to wrap up here. I have a little girl at home waiting for me, and I don't want to take too much more of your time. We've been an hour and a half already. And so if there's any burning questions that didn't get covered, reach out to me by email. And anyway, so I hope that you've got some good information tonight, and it's been such a pleasure being with you. I love sharing information. I love sharing knowledge, and just, we've all got to just do the best that we can and come together as a community, like we're all in this together. And so thank you so much for joining me, and just look out for that email tomorrow. I will get that sent out, and I wish you all the very best.